In this scenario, Jennifer Short, the study site clinical research coordinator, will contact a potential participant's primary care physician to talk about participation of a potential participant in the palliative care research co-op research study, continuation versus discontinuation of statins. During the call, the clinical research coordinator will give basic information to the primary care physician and inquire about the patient's health. The primary care physician is a bit reluctant at first, but gains a better understanding of the study through dialogue with the clinical research coordinator and agrees with participation.
Hello?
Hello, Dr. Miller. Hi, it's Ellen Snyder. I'm calling you about one of your patients to see if you believe it would be okay to approach him about a research study. Do you have just a minute to talk?
I'm between things right now, but I'll have to run in about 5 minutes.
Great. Your patient, George Snowden, looks like he might be eligible for our statin study. Do you remember hearing about that when Dr. Hansen presented it to the general medicine faculty?
Yeah, a bit. That was months ago, though. Could you remind me?
The study is an NIH-funded clinical trial to test the continuation versus the discontinuation of statin medications in patients with advanced stage disease and a limited life expectancy. Now, we're one of 11 enrolling sites, and the rationale behind it is that patients with short life expectancies may be less likely to gain the benefits of statins, and they might face added medication costs and polypharmacy. Some physicians think they should be continued and others think that they should be stopped, but we really don't know the answers for our patients.
You said George Snowden. What sort of life expectancy are you looking for? Last time I saw him, he was doing pretty well, I think. He does have cancer, of course, but he's been living okay with that since May. I know I've got his diabetes under control, and he's got a really good attitude.
Well, we have a medical record screening through the health systems database. He came up as potentially eligible because of his inoperable non-small cell lung cancer with persistent effusions. It also looks like he had to use a wheelchair the last time he came into a clinic, which was a functional change for him. Now, we know that life expectancy is an estimation only, but he would qualify if you think he meets the clinical criteria. It says, you wouldn't be surprised if his death comes in the next year. Does that sound like something that fits his condition?
Well, I guess if I think about it, he would fit that.
Okay, well, he meets our prognosis eligibility. I also need to check on his cardiac history. I don't see any history of MI, stroke, or other acute cardiovascular disease in the past year, correct? I thought his pleural effusion was attributed to his cancer diagnosis.
Yes, that's correct. He does have lots of cardiac risk factors, though. Diabetes, a strong family history, and he's still smoking. He's also got a pretty high risk for MI or stroke.
Well, he does meet eligibility for the study, and if he was interested, he would be randomized to either continue or stop his statin medication. Now, we only approach patients whose primary physicians think that the risk of participating isn't too high. What are your thoughts?
Well, I kind of wish his statin gets continued, but I think he has lots of other things to worry about at this point. As I think about lowering his cholesterol, that might not be his highest priority, at least not anymore. I think if he's interested, this study would be fine for him. You'll explain it all to him, right?
Right. He and any other family member he wants along will go through an informed consent that discusses the risks and benefits of the study before he signs up. Thank you so much. While I have you on the phone, is there anyone else that you take care of that might qualify for this study?
Sure, I'll think about it. If I see anyone else, I'll try to remember to give you a call, but feel free to call me again about someone from your screening.
Will do. Thanks so much.